This conference will now be recorded.
Good morning, everyone. This webinar is being pre-recorded for your listening pleasure on February 14th. So happy Valentine's Day. When you get this recording, it will be Thursday, February 14th. So thank you so much for joining into our monthly Aries webinars. My name is Deb Wilkinson, and I'm the Vice President of the Health Plan Options Department here at URL. These webinars are a place where you can come monthly and ask your questions and also learn legislative updates, as you see here from our agenda, both on the Commonwealth side and federal side. So a lot of these things may be review, but pardon me, a lot of them are important, in my opinion, to update you, just to bring you up to date from our last month's meeting. So let's jump right in. U.S. District Judge Reed O'Connor on December 7th ruled that the ACA was unconstitutional. So a stay was issued for business as usual until the decision, of course, works its way up through the court systems. Carriers file their 2020 plans in May and June of this year. So in my opinion, it's not going to be a stable year in 2020. I think rates and details on the plans are still unclear. So anything that's not set in stone or has a clear direction, of course, creates unrest, and carriers tend to increase rates with any uncertainty. So we'll be watching that, of course. We won't know what the rates that are filed are or approved until later this year, but believe it or not, we're getting close to that time again. 1095Bs and 1095Cs, they're due March 4th. They are originally due on the 31st of January. So that gives everybody a bit of a reprieve in the time. Also, Pennsylvania Insurance Commissioner Jessica Altman, she was named the chair of the Health Insurance and Managed Care Committee for the NAIC. The committee will be examining factors that contribute to rising healthcare costs and premiums, and will also examine state strategies to combat cost drivers. I kind of laugh at this because I believe that, all along they were supposed to do this. I think they, it's I'm not sure what results will come out of this, but I do believe that cost drivers are increased reimbursement requirements from hospitals and providers, as well as the requirement for essential health benefits, the possibility that the health insurance tax is coming in again. And that leads us to what we're watching. The health insurance tax is there's a bipartisan bill delaying the health insurance tax until 2021. That has not been, to my knowledge, approved yet. And that health insurance tax was first collected in 2014, and then Congress made a bipartisan decision in 15 to suspend the tax through 2017. And the article that I have read says that at the time, the experts estimated that the tax would contribute 2.2% increases in prices and collect about $260 billion from taxpayers. If this is revamped or reinvigorated for 2021, of course, the costs are always passed on to the consumer. So the only thing this is going to do is possibly increase costs for consumers. Medicare for all, certainly that's the latest buzz, and we're watching for that. NAHU priorities, modernizing the HSAs, removal of commissions from the medical loss ratios, simplifying employer reporting, those 1095s, they still have to report, treating COBRA as credible coverage, and then fighting back against single payer and or Medicare for all. So of course, those are NAHU priorities. And then the HRA expansions. They're talking about expanding outside of the QSERA and expanding what employers are able to do, such as outside of QSERA reimburse for individual plans, and the cost estimates for the premiums increasing, if this is done, is as much as 83%. So again, you can't have, it's the whole cause and effect. You can't have one thing change that may be a positive without it adversely, unfortunately, affecting something else within the law. So those are the things that we're watching. And of course, if you have anything of interest that you think would be, interesting to follow up on, or you have questions about it, shoot me an email, and I'm happy to research and keep that on my list of things to watch. So let's get right into the information we're sharing. UPMC's health plan's premium and ASO payment system is changing. Invoices will continue to be posted on the employer online, but they can remit payments online for direct debit from a bank, debit cards, and then credit cards. American Express is not being accepted any longer, and all credit cards will get a 2.5% increase, but you can still pay with a check or wire transfer from a billing invoice as well. So that information is going to be in the newsletter that will come out Thursday around 10 o'clock. Some good news for UPMC, all 10 states' health facilities, including Milton S. Hershey, St. Joe's, as well as the affiliated physicians of those facilities, are now part of the UPMC Premium Network. That article is also in the newsletter, but that's certainly good news for folks in the central PA area. UPMC, many of you read this. I had considered putting it in the legislative updates, but our Pennsylvania Attorney General announced that his office was filing a lawsuit to force access to UPMC's health care services and products with any health plan that wants to do business with them. So I guess the ongoing, ongoing issues for Western PA in the hospital system still exist. So that is starting up again, and in Central PA, UPMC purchased Pinnacles and other facilities moving east. So of course, we're watching that closely to see if that indeed happens in Central PA. I know that both carriers, the Blues and UPMC, have said that they learned a lot from Western PA and want to make sure that consumers are protected. So we'll see how that pans out. Central PA, we are good for another, I believe, 8 years with the consent decree. Kansas City Life Products, it is the month of love, and it's today's sales idea. So if you have a group, even if it's 2 people, let's quote a simple 25 or 50,000 life and AD&D for your groups. You can not only earn bonus dollars, but you can secure that coverage for your group. It's inexpensive, it's easy to write, it's easy to explain, and it's just another value add that you're bringing to your group clients. Highmark SEP, Special Election Period applications, Highmark system, the direct connectivity with healthcare.gov is not working, so they will accept paper applications during SEPs, and commissions will still be paid even though it's paper. So I wanted everyone to know that as well, that if you do have a client with a special election period, paper applications are accepted for off marketplace, directly to Highmark, or if it is a subsidized client that you're working with, then it's direct to healthcare.gov. And that brings us up to the open discussion. Obviously, we don't have live attendees, so no questions today. But please, if you are listening to this on Thursday and you have questions, please don't hesitate to reach out via email. Our next webinar for our Aries monthly series will be Thursday, March 14th at 9:30. I hope you can make it. And of course, our next Gemini webinar, our Geminars, will be on Tuesday the 19th. I hope you all have a great holiday and also a great balance of the week and a wonderful weekend. Bye-bye.